name is Randy Miller. I'm a plastic surgeon in Miami, Florida, and my practice involves cosmetic surgery as well as reconstructive surgery. So these days we're combining surgery, we're doing less surgery, and we're actually using a lot more regenerative components to improve the texture and the quality of the skin and put that beautiful paint on the outside with the body work done beautifully on the inside. We've been looking very scientifically at the regenerative process, and we understand now that it's not the stem cell that actually attaches to the tissue and delivers the message. The stem cell stays back here, and then it releases millions of exosomes that go into the space. And I look at an exosome, I explain that to people who are not doctors. I say it's a message. Now we've realized that we don't actually have to take the cells, we can actually take the exosomes which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing. So it's very exciting that we're actually not having to use the cells themselves. So where we've come in the last 5 years is going from the cell to the exosome. Where we'll go in the next 5 years, I would say probably towards programmed exosomes with our expertise in CRISPR and genetic science, and then being able to direct those mesenchymal stem cells to produce exosomes for a particular function or to develop a particular tissue. You know, we advance the science but also keep the patients safe. So it is true that the FDA is a very arduous, task to get drugs through approval process or to, with all the different regulatory avenues that are there with the FDA. But I think BENEV has been very, very smart to take this in a very conservative, methodical way before we get to the bigger applications, which are definitely there and waiting for us. But it takes time, it takes data, it takes doctors being able to do the right thing. And so I think that BENEV has been very, very smart to kind of position themselves in the regenerative medicine market, in the arena, to bring the science to the patient, but make sure that the doctors are treating the patients properly within the guidelines of the FDA and with all the compliance, but getting to see the beautiful benefits of the exosome as a topical therapy. And it gives us great excitement when we see how nice it looks on the outside to think about what it's going to do on the inside when we take some of these exosomes and we do take it through the drug approval process, how special that will be. But this is a time where patients can benefit from regenerative science and get that beautiful glow without having to do anything risky, without having to do anything that's going to be harmful to their health, and to do something where they're being guided by healthcare professionals that are doing things the right way for the patients.